We have today Mr. Charles Round. He is 60 years old. He's been a patient of mine since June of '02, which makes it 6.5 years. And he's been on testosterone replacement for quite a while now, since March of '03, which is a little over 5.5 years. What were you like before we started the testosterone replacement? What was going on?
Well, I had a serious back injury, and
That was when?
that was April 30th, '02.
So a year before we started with this.
And basically I could not get up off of the couch. I spent all my time on the couch. I slept on the couch, and I pretty much could not do anything.
Was this only because of the back injury,
Yeah,
or because you were also physically weak and lack of energy?
Lack of energy, physically weak, and I had mentally depressed and everything else because of the things that were going on with my injury,
You also had some problem with anxiety at that point before the testosterone?
Yes, well, there was like a problem with the case, so I was very anxious about that, and I had anxiety and I had panic attacks, and at one point I even went to the hospital for the panic attacks.
So they were pretty severe.
Yeah.
So you were physically...
I had the panic attack while I was in my psychologist's office, and he called the 911 operator for the ambulance to come.
And your energy levels were low at that point?
Yes, yes.
And
it was a dragging.
And sexually?
Sexually, very bad. I had,
No libido at all?
No.
And your testosterone level came back low, so it was in March of '03 we started you on testosterone replacement, and what happened? Initially we started you off at that time was giving it to you every 4 weeks.
Mm-hmm.
And what happened on the 4-week regimen?
Well, I was able to I no longer spent the days on the couch. I did I did get back some of my energy, and was able to do more things, walk around more. Of course, the pain in my back limited me to that, but before I didn't have the energy to even get up. So we spent most of my time on watching TV and or movies, and just literally just sort of hanging around on the couch.
And the 400 milligrams every 4 weeks improved that?
Yeah, it made it so I was able to get up off of the couch and do more activity.
Did it have any psychological effect on your depression or your anxiety?
Yeah, I noticed that I was less depressed, and actually the anxiety attacks stopped. I hadn't had any anxiety attacks during that period of time.
And sexually, did that have an effect at that time?
Yes, I was able to, resume, having sexual relations.
But then after a period of time, a couple of years or so, or a few years, we increased the dose to every 3 weeks.
Right.
Was there any further improvement then?
Oh, yes. Yes, at that point I became much more active, was able to do things, within the limitations, I was able to do more. I had more energy. That was one of the things. I started to notice that I was less anxious and less depressed. Although I did lose my wife in 2004, so that was a real issue.
Mm-hmm.
And I think that the testosterone helped me get through that. And so that was one of the major problems.
And then at one point, a couple of years ago, I guess, we got to the maximum dose. We gave you 400 milligrams every 2 weeks. Mm-hmm. And there was still further improvement.
That's when it really started getting much better. And in fact, at this point, I decided that I would go to the gym. And of course, the person I was with said, well, I wouldn't continue with the gym. I wouldn't even be able to do that. And when I did go to the gym, I found that I was able to do things, do the exercises, and but I wanted to get a personal trainer. So I took, and previously, before that, I must add that my knees were so bad from just sitting around and not being quite as active as I was, and not doing any exercise, being able actually being able to not do any exercise, physical exercise. And so my knees were so bad that I put my house up on the market because I live on 3 floors and I couldn't walk up and down the stairs anymore. So I decided to go with a personal trainer, and I had 10 sessions. That was 2 times a week, 5 for 5 weeks. And during that period of time, I told her exactly what I wanted to do, zero in on the muscles in my legs. That would increase the, because of the back injury, the muscles had atrophied, and of course sitting around on the couch doesn't really improve your muscles either. And so within 10 weeks, within 5 weeks, 10 sessions, I no longer had pain in my knees, and I was able to continue with the personal trainer, and have stayed with her during this period of time, and have been able to increase the muscles throughout. Given the fact that I have back injuries, I don't look like that. I don't look like that.
And you credit the testosterone replacement for giving you the ability to do all this.
Yes, because at one point the dosage was lowered to 300 milligrams, and is it milligrams?
Yeah.
300 milligrams. And during that 1 month period, my personal trainer told me that I didn't speak to her, and that she had to lower all of the exercises, change everything, and that because I didn't speak to her, that showed I was depressed again, and I was not feeling as energetic, and
this was from lowering the dose from 400 milligrams to 300 milligrams.
To 300 milligrams.
Because there was a question of you developing some acne from the 400.
Right. And
but your dermatologist, what was her reaction?
Well, when I went back to the dermatologist, and she saw how I was, and that I was sort of listless and not my normal self, she told me to tell the doctor to put me back up to the 400, and that she would continue to prescribe the antibiotics that I was taking for the acne.
But also this acne was nothing new. That started with the testosterone. You had the acne before the testosterone.
Right, I've had acne throughout my lifetime.
So the dose for you is very important, that you get the 400 milligrams every 2 weeks.
I did want to say one thing about
Sure.
the acne, because it's important to know that at first I had the acne when I first started on the testosterone treatment in the head, and that is totally gone. Now I'm getting like pimples other places, and that I would get anyways normally, so it's really not excessive amounts of pimples.
How are you today in regard to your strength and your energy and your psychology and your sexuality? How are these things now?
I think one of the things that changed, because I don't get so tired, I don't take a nap every day. I would literally be so tired that I would just have to take a couple hours off and sleep.
And as far as your physical strength, you told me that you had, at one point, your leg had atrophied a little because of your back injury, and now that's not detectable anymore.
No, yeah, that's correct. When I went to a physiatrist, she measured my legs, and they were identical. They were the same. So much so that she said that I didn't have any back injuries. Because one of the claims of determining whether you have back injury is if your leg is atrophied. Well, if you're working out and you have the energy to work out, and if I didn't have the testosterone, I would not have the energy to work out, so there would be atrophy in that right leg. And I do have nerve damage down my right leg, so that has been confirmed with that computer test.
And as far as your depression and anxiety?
I'm much less, well, I haven't had any anxiety attacks. I mean, if something happens that, I get really upset. I did have one, but it was like, very short-lived, like not for a week, like, so I thought I was dying, and that's how they used to be. They were horrible. And then the depression, I'm not depressed I'm not depressed like that. I certainly don't have crying episodes. And I used to spend a lot of my time being very upset and crying and everything. And actually the situations have really gotten no better. I mean, nothing has really happened that would be
Nothing in your life has
Nothing
changed to
has
make this difference.
My wife did pass on, and that was an issue.
Right.
But you know, after that, I was able. I think that's one of the things too. I was able to take that and to go during the process. I went to the nursing home, not the place where she was staying, the facility, every day, and I drove every day. I can't drive more than 45 minutes without it being in agony. So I drove every day, and I went to the nursing home, to the facility that she was at. And then finally I broke it down to two times a week. And I did that for 7 months, every single week. And so, you know, my activities, including, and then in addition to going to the gym, in addition to going to all the other things, I was able to do that. And then on occasion I would go in on well, it was Sunday and Wednesday. Wednesdays and Sundays is when I went.
You've also told me of a change in your self-esteem since you've been on testosterone replacement.
You know, I feel much better about myself. I don't have thoughts of suicide or...
You used to have that?
Yeah.
Hmm.
Things were so bad that...
Now, one final thing. You're 60 years old, but God Almighty, you sure don't look 60.
Yeah.
And you told me...
My organizer, who I had to hire because I was going to sell my house, she was helping me throw off the stuff so that I would have my house
And by the way,
ready.
you did take the house off the market.
Right, the house was taken off of the market. But she's still with me, and she has seen photographs of me back in 91, 92. And she said, I look younger now than I did back then.
Yeah, this is an almost universal effect of testosterone replacement. Once you've been on it for a year and a half or 2.5 years, is that people routinely look 10, 15, 20 years younger.
Right.
And certainly you don't look 60. I'm very happy to hear all this. I'm very happy about the success we've had. And
Yes.
thank you very much for helping us.
Okay, thank you.
Okay.